So dental implants are not really a new hot thing, but they are a way to replace a space in your mouth. So say if you didn't want a bridge, say if you didn't want a partial, then dental implants is really a really good option. It's good long-term wise. It has like over a 90% success rate. There are some factors that do limit, if it's successful or not, but those we literally go over, make sure you don't have any of those health problems or any kind of habits that will prevent this implant from taking. But the implant literally is a screw that goes right into your bone where that tooth is missing. And once that screw is in, we have to wait for it to heal. So that healing process is around 4 to 6 months. And once that bone and that screw integrate and become one, then we're able to put a crown on top of that tooth. So now you don't have to mess with any of the teeth on either side of it. If you had, chosen a bridge instead, it's just that one space, that one, area that you can mess with. And once that crown is in, then you could use it as any other crown or any other tooth really. You brush it, floss it like any other tooth. You keep up with it. You come for your cleanings, and it's like nothing was ever missing. But dental implants, only downside to it, it just takes time. But long-term wise, it is a really good option, especially if you have enough bone in that spot and if you have, tissue for that implant. Way to properly do it, you do get additional training after dental school. You can either take continuing education classes and kind of courses where you learn to place implants properly just so you could restore them in a good manner. So that is something that we have done here in Trail Dental Studio, where we have taken courses to where we are trained to do implants. If it's not done properly, you can experience, infections like any other tooth. You can experience infections around the actual implant, which will cause you to have to get that tooth or that implant removed. If you're not keeping up with the implant either, if you're not cleaning it or coming for your dental visits, then that can also cause the infection to start, which will have to be removed as well. But properly to do it is really, getting the proper education for it and proper training for that implant course.